Welcome to one more episode of New Business Do podcast. In this episode, we will speak to Dr. Nayan. Dr. Nayan is the co-founder and CEO of Avegen, maker of a health machine. Yes, a software as a service platform for deploying digital care programs that improve the health of individuals with long-term conditions. Avegen is a digital healthcare company empowering individuals to take control of their health and supporting healthcare professionals in delivering life-changing care. Avegen's health management platform is being used by healthcare providers in UK and India to take care delivery beyond the four walls of the healthcare facility, ensuring that patients have access to proactive and personalized care. You can find out more about Avegen at www.avegenhealth.com. Now, Dr. Nayan, can you introduce yourself to our audience and speak about the reasons that makes you start up this company and that somehow you left the doctor in the consultory in the hospitals to be an entrepreneur? Can you let us know the reasons why?
So I've always been very passionate and interested in health and mostly what is health, how do we improve health, and I trained as a medical doctor, as you know, um, and I practiced in a small city in India, and I aspired to positively impact more people. And at the same time, I also had an interest in information technology. This is back in the, I would say, 2000s. So I was quite interested in technology. And so what happened, I think, when I was in medicine is I had a friend of mine who got diagnosed with type 2 diabetes. And over the course of, I think, 3-4 months, I worked with him on improving his nutrition, improving his exercise, and we were able to control his diabetes without taking recourse to medications. What I knew is that as pretty much I was giving him one-on-one treatment. Now the question was, how does one actually take this to thousands of people? And that's where, my interest in digital technology gave me an idea that, one can actually do personalized care to patients at scale using information technology. So that's one of the reasons why I migrated from being a medical doctor to using my interest in medicine and in uh, technology.
That's great, thank you. And it's about to use the digital technology to help more people, to reach more people. And
Absolutely.
yeah, that's very nice. And explain, introduce it to the service your company provided to the health industry. How how your service helps people and what is the role of technology on this?
Yeah, absolutely. So at Avgen, what we do is that we design, develop, and deploy digital care programs. And these digital care programs are for the benefit of patients with long-term conditions. So today we have digital care programs in HIV, in pregnancy, in cardiology, so different diseases. Now, what is a digital care program, right? So a digital care program is it's a personalized intervention where what we do is that we educate the patient about the particular condition. We support the patients in tracking how they are doing. We also give the patient the ability or the tools to share how they are doing with their clinicians. So that is what a digital program is, and we partner with pharmaceutical companies and healthcare providers to roll out these digital programs. And the benefit for the patient is that instead of keeping notes or instead of going online and reading things, they are able to access things that can actually benefit them, and that is more importantly personalized to them. And from a clinician perspective, how they benefit is that now they can actually support a much larger group of patients using our technology while ensuring that they're able to maintain that degree of personalization that is required when you're working with people.
It's an application. It's an app that the patients can download in his mobile phone. Is that how it works?
Broadly, yes. So if I'm a patient with HIV, they can download the care program for HIV. There might be somebody else who might be pregnant, so then they can download an application for pregnancy. Right. So it is not a single application that caters to all the different conditions. We have condition specific mobile applications. Now, where technology actually helps us scale is that instead of having one stack for every application, all of these applications run off the same backend. So we are able to support different disease areas using the power of a SaaS platform.
That's interesting. And then you collect the data from the patients, and this data is presented to the doctors and as well to the clinicians.
Yes, so the data is used for multiple reasons. One, the data can be shared with the doctors if the patients want to and patient gives consent. So that's the first use of the data. The second use of the data is using the data to personalize the content that the patient might see. So for example, in pregnancy, if from the data we are able to make out that the mother is at high risk of preterm delivery, then we are able to push content to the mother that can help reduce the chances of a preterm delivery. So that's the second reason for using the data. The third reason for using the data is to to ensure that the mother actually stays with the program or the patient stays with the program for around 12 weeks. And finally, the fourth use of data is to generate evidence that patients who are on our care programs do better than if they were not on our care program. So those are the four reasons for which we use the data.
And this data provides analytics for the management team inside your corporate clients. You have two clients. You have the patients that
Yeah.
benefits for better treatment, better follow-up of their treatments, and so
Yeah.
forth. And you have now the, let's say, management side. As myself as a manager inside a hospital or a clinic, I can use this data to make better management of my resources. Can you
Correct.
explain the benefits of our product looking at this perspective, the management perspective?
Sure. So from a management perspective, the way they benefit is I can give you an example of one of the largest HIV providers in probably in the world, and the head of that unit, she has around 30,000 patients under her care, and they are supported. These patients are seen in 18 clinics. Now, previous to implementing our program, she did not have any visibility into how many patients are new, how many patients are coming back for their visits, which counselors are managing more patients. She didn't know what the patients wanted. Do the patients want more information about testing? Do the patients want more information about medication? She did not have any line of sight into what her population of patients are doing. And now with our program, what she's able to do is she can log on to a dashboard. She can go clinic by clinic and get a sense of how that whole patient population is doing. Not just how many patients are coming in, but actually the characteristics of that patient population. And this obviously informs her decisions on what to invest in. Should she invest in a testing program? Should she invest in hiring more counselors? So that's how she's using the data to manage her own organization better.
That's very interesting. It's a transformation analogical management, which would be looking at different systems, and now you are putting all the data together and giving more analytics to the management team. We have challenges as well for the adoption of data analytics, big data, and this kind of automation for traditional companies. You are very used to deal with these complex paradigms from the traditional way of doing things inside, let's say, a clinic or an hospital, and migrating, doing the digital transformation. Can you talk more about the challenges and how do you help your clients, your corporate clients, to migrate, to do this transformation from traditional to more digital and data-driven decision making?
I think one of the challenges quality of data, because if you can if we think about data and we are taking key decisions based on the data, the raw data has to be of high quality. And now that is not very, that sometimes can be extremely challenging in the real world, right? Because you're depending on people to input data, you're depending on people to ensure that the data is complete. So I think the quality of data is, I would say, the first challenge that I think any organization needs to tackle. And it's a never-ending process, because as you collect more data points, you increase the probability of having bad data. So that's the first one. The second, I think, challenge is we can't forget that a lot of the change is ultimately about people. I mean, people are the ones who can make things better and who can make things worse. If we just look at data, there is always a possibility that we might be misinterpreting that data. And a lot of the times what I see is the reason why people do not adopt data-driven decision making is because they think that the data is not reflective of the circumstances. Like they question the credibility of the data. So I think one of the key things as management, I think one needs to do is reassure people that this data is being used to make their lives better and not make their lives harder, right? And in healthcare, actually, we see that a lot, because a lot of hospital systems introduced electronic medical records, introduced all of these things, which from a billing perspective was very helpful, from a management perspective was very helpful. But if you talk to the frontline health worker, they just punching in this data, but they didn't actually get any value in their day-to-day job. So for me, I think to summarize, I think those are the two key challenges. One, ensuring good quality data, and second one, ensuring that these systems capture is used to benefit the people who are at the coalface, either the patient or the provider.
Said that, I would like to connect these two points. First one, how to engage the front lines, people that are in the field working and now need to input more data, and as well to make decisions based on data. And the second, the governance of this data, because it's very sensitive data, isn't it? So
Right.
can you elaborate thinking about these two perspectives?
Mhm. So I think with respect to the first question, which is, how do we engage the frontline users? It does come down to how user friendly the whole system is, the whole software application is, and the simpler it is, the easier it is for them to input. So that's the first one. The second one is reducing the friction to collecting data. So for example, can we use wearables to collect data from the patient, where the patient does not even have to think about inputting the data, right? So can you make seamless data capture? That I think is the second one. And along those lines, if this data has already been inputted in some other system, can we draw upon that data rather than needing the user to re-input that data? So I think the way you engage the frontline user are using these two principles. Data governance, I think, is a completely different ball game, and I think as healthcare, when we are handling healthcare data, especially personally identifiable information and sensitive data, data privacy has to be there from day one. I mean, it has to be by design. We need to set up a software that is able to anonymize, that is able to pseudonymize, everything should be encrypted either at rest, transit. So technologically, I think that reduce the uh, we should reduce the impact of having any um, unwarranted data leak. So I think security becomes paramount. So making sure that annually or even maybe more frequently doing a penetration testing so that no unauthorized users can actually get access to the data. Then obviously there are things from a regulatory perspective, right? Having a data privacy officer, having SOPs in place so that in case there is an inadvertent breach, we are able to mobilize the team quickly to plug that leak. Also, what was the other thing? Yeah, the other also thing is that sometimes educating the frontline users, right? So they sometimes send data that they shouldn't be sent. It's also training them on what good data practices are. So I think those are the ways that one actually deals with data in a sensitive, responsible manner.
It's about not only data governance, but as well cybersecurity, and then training the frontline,
Yeah,
training all the team to deal with this, and have specific people as well.
exactly.
Yes. And let's talk about what can go very wrong during the digital transformation journey of a company. I mean, what are the pitfalls managers can avoid in this journey of digital transformation?
I think the pitfall is one, I think fatigue, right? I mean, digital transformation takes a long time. It can take a long time. And sometimes one doesn't see the benefits immediately. I mean, look at us, right? I mean, uh, COVID has catalyzed us doing most of our business now on video calls. I mean, it could be Microsoft Teams, Google Meet, Zoom. It wasn't like this technology wasn't there before. It was, right? And the benefits are immense, but the uptake was not what it is today. I mean, today we are so used to doing conferences online. So for me, I think that the key challenge whenever we do digital transformation is getting enough people to adopt it to then actually see benefits for the whole organization. And that I think, I mean, you don't need a COVID every time to be able to catalyze that. I think from a management perspective, that's what we need to think about. How can we catalyze the adoption of good quality digital tools by the company? Yeah.
Great, great. And in your opinion, how the board of directors and the C-suite, the top management team, the CEOs, should lead the digital transformation in their companies? What are their, let's say, responsibilities and how they should lead this transformation?
Sure. I mean, it's a very cliched answer, right? But we have to lead by example. I keep talking about, digital technology, but then I use pen and paper. It's like, I'm saying one thing and doing something else, right? So I think the most important thing is lead by example in everything that we do, either in meetings, second one is I think be realistic and aware about the human challenges with technology. Adoption does not come naturally to people. There is, I think the new generation, I think is different. They grew up with iPads and smartphones and all of that. So for them, it's second nature. But there is still a generation, there are a couple of generations for whom technology is not second nature, right? So be realistic about the adoption curve, the adoption challenges, and be supportive of it, right? And so for me, I think um, from a management perspective, I would say those are the two big things that one needs to do: lead by example and be realistic and really push your vendors and suppliers to ensure that their software applications or whatever they bring on board can actually be can actually be is actually adopted by colleagues, right? If you bring in a system that is clunky, that is difficult to use, it's not going to happen. It's not going to take up. And that responsibility of pushing for user centricity, pushing for high usability, I think lies with management. And obviously, if one uses it, then is it something that the rank and file will adopt? And that's what we have seen. So we use a lot of technology in the company. We tried a lot of things, and the ones that are easy to use are the ones that have got adopted. And if we did not use it as a management team, we would never know. So I think for me, those are the two things. Lead by example and make sure the technologies that you adopt are user friendly and user centered.
And what would be the main points of attention for the boards and for the top management team in terms of managing the digital ecosystem now? Because it changed the dynamics. That's clear. Yeah, you
Yeah.
have now everything more digital. Your customers' information are digitized, and then you have different responsibilities and mechanisms for governance. What are the key, let's say, two things or assumptions or problems that you say, oh, this requires more attention?
Two things. One is definitely around data security, right? Because nowadays we have so much data about so many people. If there is an inadvertent leak, it can take a company down. I mean, from a reputation perspective, from a liability perspective, from the penalties that you might get. So data security and data governance, I think, is a key topic for the board, any board, I would say. And the second one is also, previously one would look back every quarter or every 6 months and look at, okay, how is the company doing? How is the team doing? Because it was very onerous to collect data and analyze data. Nowadays, we can do everything pretty much in real time. So I think the board needs to also ensure that the companies are putting in systems that gives the CEOs and the executive team a much more real, immediate feedback on the performance of the company. So in some way, I think those two things are contradictory to each other, because I think for real-time data, you actually need to be much more confident in your data. But at the same time, handling data frequently means that you increase the probability of a leak. So, but I don't think they're contradictory to each other. I think one can do both, managing data responsibly and having the right security systems in place, while also leveraging the data to manage the company with a much more informed view on a real-time basis.
Looking at to the future now, what is coming next in terms of digital technology, impacts on business management, and what are the strategic implications for the companies?
I think going forward, I think, with COVID, what I think is that we are all going to be less vested in being co-located. There is still a role for the office, but my sense is that we are going to see more, around virtual reality, around augmented reality. Uh, I think that's where it is going to go. Like today, I know we are doing a Microsoft Teams call. Tomorrow, you and I might be sitting in a virtual conference room having this chat, right? So I see that happening, and we are literally obliterating the need for travel, need for boundaries, need for borders, because I think everything is going to go virtual. So most of our life is going to go virtual, and there's no reason why companies will be out of it. Like with connectivity pretty much becoming ubiquitous, you and I might be in different parts of the world, but in the same room having a conversation. So,
I appreciate your time. I know that you are very busy times. Uh, but always a pleasure to talk to you and speak your and listen to your experience. It's always great. Thank you very much again.
thanks, Fabio.
See you.
See you.
Thanks for listening to one more episode of New Business Edu podcast. Check out our YouTube channel as well for complementary materials, some lectures, and some other interviews. See you in the next episode. Bye bye.